Hello and welcome to CPC Exam Practice Question Series from Skillra. The topic for discussion today is Pregnancy, Obstetrics and Gynecology. Let's get started. Question 1. Which of the following structures is commonly called as the water bag? Option A, uterus. Option B, fallopian tubes. Option C, ovaries. Option D, amniotic sac. The correct answer for this question is option D, amniotic sac. The medical term for the water bag is the amniotic sac. Let us eliminate the wrong options. The uterus is the site of implantation, gestation and development. The fimbriae of the fallopian tube capture mature eggs and provide an ideal environment for fertilization. The ovaries produce and release mature eggs. Question 2. Which of the following procedures are obstetric procedures? Option A, amniocentesis. Option B, cordocentesis. Option C, episiotomy. Option D, all of the above. The correct answer for this question is option D, all of the above. Let us eliminate the wrong options. Amniocentesis is puncturing the amniotic sac to withdraw fluid. Cordocentesis is collection of fetal blood through the umbilical cord. Episiotomy is making an incision into the posterior vaginal wall and the perineum to quickly enlarge the vaginal opening during normal delivery. Since all the above procedures are done when patient is pregnant, they are called as obstetric procedures. Question 3. Placenta previa is option A, placenta is attached to the top of the uterus. Option B, placenta is attached to the side of the uterus. Option C, placenta covers the cervix of the uterus. Option D, none of the above. The correct answer for this question is option C. Placenta previa is a pregnancy complication where the placenta covers part or all of the cervix, causing painless bright red vaginal bleeding in the second or third trimester. Question 4. Hyperemesis gravidarum is option A, severe persistent nausea and vomiting during pregnancy. Option B, hypertension during pregnancy. Option C, back pain during pregnancy. Option D, none of the above. The correct answer for this question is option A, persistent nausea and vomiting during pregnancy. It often leads to dehydration and weight loss. Let us eliminate the wrong options. Hypertension during pregnancy might lead to preeclampsia, and back pain is one of the common symptoms during pregnancy. Question 5. Which of the following are functions of the placenta? Option A, provides oxygen and nutrient transfer. Option B, waste removal. Option C, provides protection and immunity. Option D, all of the above. The correct answer for this question is option D, all of the above. The placenta is a temporary organ crucial for fetal development, acting as a lifeline that provides oxygen, nutrient transfer, waste removal and endocrine support. It facilitates respiration, nutrition and immunity by passing maternal antibodies, which is the IgG, to the fetus. Additionally, it produces hormones like HCG, estrogen and progesterone to maintain pregnancy. Thank you.